Hi, and welcome back to Real Talk Fitness with AMPT. For those of you that are just jumping on and listening, I'm the owner and founder of AMPT. I'm also a mum of 2 boys, and I know just what it's like to read through and try and filter through all the information that's out there to become the best version of yourself. So that's why I've created Real Talk Fitness with AMPT. And today I've got a special guest with me, someone you've all heard me talk about inside the gym, Josh from Body in Motion. What we're talking about today is dry needling, because it can sound a bit scary. But if you've ever tried it, the result is game-changing. So in today's episode, we're breaking it all down. What dry needling actually is, why it works, when you should consider getting it done, and how you know it's right for you. So we welcome Josh onto the podcast. We appreciate him taking the time to talk to us about it from the therapist's point of view. So let's get stuck in. All right, so welcome onto the podcast, Josh. So what we're going to be talking about in today's episode, I feel like I get asked a lot, is what is dry needling really? So I guess, can you explain this in the most human, non-clinical way possible to anyone listening in terms of what is it and how can they benefit from this opposed to just a normal massage?
Yeah, for sure. The easiest way to describe dry needling is because obviously it sounds a lot scarier than what it actually is. For the most part, it kind of just feels like a weird sensation. So essentially it's just your muscles. There's like a dysfunction in the muscles, so that tightness may feel like a little a ball or ropey feeling. And those knots can cause pain and stiffness and tightness, and that stretching can't quite fix.
Yeah. What does the needle do in benefit opposed to like a massage? Like if someone gets a remedial massage, because I know with myself sometimes the remedial hurts more and a direct needle will give me more relief.
Yeah, I guess I get that actually quite a lot. Some people say that the needling's a lot more nicer than the use of my hands. So it's just a more direct, easier way to actively reduce that dysfunction from the knot. Okay?
Yeah.
So it's pretty useful in terms of like you don't have to sit there for 5-10 minutes or whatever trying to get rid of this knot that's not going to go anywhere. So obviously the massage works superficially, and needle is obviously straight to the point. It's like straight into that muscle, straight into the trigger.
Yeah. So basically, instead of like someone digging the shit into your muscles for about 5 minutes with their elbow, you can basically use a needle directly to that area and get the same or better result.
Yeah, 100%. Yeah. So the works. Obviously, some people can handle a lot more needling than others. Usually, I try and be a bit more reserved with new people because you don't know how they're going to react to it or respond later in terms of from it.
So how does that work in terms of the nervous system? Because again, like getting back to that remedial side of things where like, you're pushing really hard or whatever else, and like needles, obviously you have that heavy feeling afterwards. When you say some people cope better than others, is that to do with their nervous system or their body can handle more stress?
Yeah, 100%. Yeah. So, the nervous system can, it's just the same as like someone's pain tolerance.
Yeah.
So some people can handle more pain than others. It's just those people that got tattoos, right? Some people can handle hours, some people can handle a lot longer.
Yeah. No, that makes sense. So I guess when would you recommend someone to use dry needling opposed to just a deep tissue massage?
Yeah. So recommended. Obviously, I mean, you're aware of my treatments, I guess. So I do a bit of dry needling and massage together. Super effective. I don't really just do dry needling by itself. So essentially, those Garven trigger points and those muscles that just won't let go, whether it's from an acute injury or it's a longer stubborn injury that's been hanging around for ages.
Yeah, so you'll just do the needle and then the massage after it.
Yeah,
What does
yeah,
the massage after you do the needle, is that just to move through the muscle to return it back to its stretched position, or like what's your theory behind doing them both together?
yeah. So, well, I guess it can calm the nervous system down after the needling.
Yeah.
Um, you can also gives you that or the option to, if you need to do more needling as well.
Yeah.
On some other areas that need to work on. You may have missed some, so it gives you a sweep through as well. So even though that you guys are just feeling us massaging in our brain, we're working, thinking, all right, how does this muscle feel? Does it need another needle somewhere else? Is it, that's kind of like what we're running through our head. It's the same as if the initial conversation I have with people, I'm already thinking about what I'm going to be doing with you while I'm talking to you.
Yeah. No, that makes sense. And when after somebody has needling, like what do you recommend afterwards? So like say obviously not using myself as an example because I feel like I break the rules in terms of what you should and shouldn't do to get maximum benefit. But I guess, after someone's had needling and like a bit of a massage, like what's the best thing to do afterwards, like training wise? Because I know a lot of people come in after they've had needling and they're like, oh, they just said to take it easy.
Yeah.
What's the body's process in terms of healing after, I guess, somewhat traumatic to release the muscles?
Yeah. It all depends on what the person is going to be doing. All right. So, yeah, just like you, for example.
Yeah,
So,
you can use me as an example because
you,
I'm
you
not a great example.
comps, right? So, um, I wouldn't be needling you, a couple of days before, so to
Yeah.
speak. You're thinking at least a week, give or take. If you just gen pop people that are just going to normal training and stuff like that, like realistically, there's no reason why you couldn't do training same day, next day. It just depends on your intensity of like the person,
Yeah.
the therapist has done on you as well. So if it's a light session that the therapist has done, then you can, generally it's all right. Again, it's the same case by case because it depends on the person's response,
Yeah.
and their activity level after it. So, like I said, if they're just going to a normal gym session, then I wouldn't be going and doing. Let's say I did your hamstrings, right? Like I wouldn't be going and doing sprinting straight after that type of stuff.
Yeah.
About
Yeah.
being smart as well as listening to your body, but
Yeah. No, that makes sense.
yeah,
And
something you don't do.
yeah, no, 100%. But I just hope that my body just runs optimally all the time. But I guess the inflammation that happens after it, like I know when I've had a quite intense dry needling session,
Yeah.
generally, as we just spoke about, like, that my next session will be kind of light because I feel that the body is quite inflamed. Does the dry needling cause like a inflammation response?
Yes. In a nutshell, it does. Yeah. So creates that response for the body to offer its own natural healing process. So it's the same as if we do actually injure ourselves, swelling occurs, etc., inflammation, and that's the body starting to heal itself. Obviously, we spend all our time trying to get rid of the inflammation because we don't want the swelling around, but at the end of the day, that's what the body's natural process is, and it's no different to whether you're needling or massaging, etc.
Yeah. So that, I guess that's why, like, another reason why needling can be a little bit more effective than deep tissue massage, in the sense that it will cause that inflammation to help recover faster.
Yes.
Yeah.
Yeah.
Yeah. Because
Yeah.
I feel like a lot of the people that I talk to about it, they kind of look at me and go, "Oh, is that just like acupuncture?" And I'm like, no, it's completely different, but it's a lot more effective, especially if they are really tight.
Yeah. So acupuncturists can do what we do. We can't do what they do. But
That's really interesting.
yeah. So that's a whole, the acupuncture is it's a whole, if you would call it a trade by itself, so to speak.
Yeah.
Like 3 years or something you would have studied for it. There's a bunch of stuff that I don't understand. So
Yeah. Yeah.
dry needling was designed, I guess, to be straight into the muscle, very direct, get that response, allow some normal function to return to the joint or the muscle, and it's about the person, how they, I guess, they recover, and then ongoing from there. So obviously, it's can reduce the symptom of the pain, improve movement, and then essentially, if the therapist knows enough, or whether the person does, or they see a physio, it's about returning to normal function and hopefully preventing that from reoccurring.
Yeah. No. And I feel like the frequently asked questions that I'm sure that anybody listening to this episode will probably want answered is the and we kind of touched on it in terms of like people's pain threshold and stuff, but ideally, does it hurt is something that when I recommend people, they're like, does it hurt? And I guess it's hard for me to answer that in terms of everybody's different pain threshold,
Yeah.
but what would your response be, being the professional, if someone was to ask you that?
Yeah. So my professional answer to that is it doesn't hurt, just feels weird, because every time I do it, particularly on someone new, the first thing they say is, "Oh, it doesn't hurt, it feels weird." So it's literally the
Yeah.
easiest way for me to describe it. I said this. I always say it's a twitch or a pulse that the person will feel. Yes, there can be bigger and smaller ones. If you're working on someone new, you might only elicit one twitch. If you've got someone that's more regular, that can handle more and understand it, then you'll get a few more. But that's up to the therapist and the person kind of communicating and going from there. Anyone
Yeah.
be doing that. The only pain that you may get is the initial insertion of the needle. Usually, that's from hitting like hair follicles and stuff like that. So that's that stinging feeling. The therapist just takes it out, reinserts it, and she's good to go, or discards the needle and gets another one.
Yeah, okay, no, that makes sense, because that twitching, and I feel like that just opened a whole nother question. Like, sometimes how you said you get small ones and you get bigger ones, is that displaying the tightness of the muscle, or is that just technically how deep that the needle's going that you're using?
Yeah, it's usually towards the tightness part of it, so not so much the deepness of it. So there's obviously different lengths of needles. Some triggers can be super superficial, in other words, like super shallow, just below
Yeah.
the skin, and others are a bit deeper. There's other factors in play, obviously, with the size of the person, whether they've got more body fat, whether they're heaps muscular, stuff like that as well. So,
Yeah. And that determines like the length and the thickness of the needle that you might use
yeah,
still to
generally
get the same effect.
Yeah, generally more lengths. I mean, there's different types of needles, different lengths of needles, brands, and stuff like that. I generally just use it's a 0.25 of a mil, so it's super tiny in terms of its thickness.
Yeah.
Most people, I guess, have never paid attention, but the ones I use range from 30 mil to 75 mil. So 75 mil, large quads, glutes, that type of stuff.
Yeah, yeah. Okay, no, that's quite interesting. And I guess people sometimes, some people bruise and some people don't. What is the theory around that with the dry needling? Is that just person dependent, or is that just
No,
coincidence?
I guess you do have those people that may be a bit more susceptible to bruising itself. The main reason why some people, well, you do get a bruise is you've hit a superficial vein.
Yeah.
So it's not the be all end all. Obviously, you don't want to hit a vein because you cause bruising, but look, it does happen. So it's not a bad thing. So
Yeah. No, that I think that's good. That would clear up a lot of questions when people are listening to today's podcast, because I feel like, as somebody that trains myself, like my go-to is dry needling every time,
yeah,
opposed to a deep tissue massage. And I feel like these, when I recommend them to general pop, only purely because I know that the relief that they get, the movement that they'll get afterwards, opposed to, being put on the bed and elbows and all of that sort of stuff, and being put through a lot more pain to get relief. And these are the questions that I feel like people commonly ask, like, or I bruised here, or I didn't bruise. And it's like, it's really interesting to hear from your point of view of the actual science behind all of that. So when the other question that I feel like I get asked a lot that might benefit anybody that's listening is, how long does the relief generally last? Like, I know that's a hard one to directly answer, but I guess, like, what are your thoughts on that?
yeah. So I guess you said days to weeks. Look, I've had people kind of say, "Look, I haven't come back to you because I haven't needed to," and it's been months
Yeah.
fix that lingering issue that they've had, and it hasn't returned, and then it's coming back as a touch up, so to speak. It also comes down to the person's, how harsh they are on their body. Is where
Yeah.
they flog themselves at work. Is it a physical job? Do they hammer themselves at training as well? The body can only take so much, so it depends on the level of activity after.
Yeah. Yeah.
Yeah.
No, that kind of like answered it, because I know that question, like, I feel like if I was a therapist and getting asked that, it's kind of hard to answer that directly because it's all person dependent. But I guess, yeah, you nailed it in terms of it really does depend on the person's job, and how hard they train as well. And I guess how often should someone get dry needling, just as, say, if we're just talking about gen pop, just to make sure that their body stays mobile and they stay in good health and condition, muscle and joint wise?
Yeah. So, well, if you say like a maintenance phase, look, it's in the ideal world, if you do a maintenance, you're looking at like 4 to 6 weeks, right? Unfortunately, we live in a world where people are constrained with money, stuff like that as well. So, but if you gen pop, look, monthly,
Yeah,
the 4 weeks, give or take.
would be ideal.
And look, sometimes you can do a couple of sessions close together, and then you can get a good couple of months out of it. Again, it depends on the person's activity levels after the fact of the session. So yeah.
Yeah, no, that makes sense. And is there anyone that you would say that dry needling's not for?
Not for, yeah.
Yeah, so like, is there anyone that should avoid it? Like, obviously, briefly before we started recording, we spoke about, like, people with obviously needle phobias, and that sort of thing. But is there anybody that, generally should avoid dry needling and just focus on deep tissue massage?
Yeah. So you would say obviously those needle phobia peoples,
Yeah.
anyone with skin issues, infections, stuff like that. That would be, you wouldn't go anywhere near that section. Not to say that you can't needle anywhere else, or is to just bypass that
Yeah.
affected area. Bleeding disorders, stuff like that. And then pregnant women should, in theory, get a GP clearance for it, because the last thing you need to do is cause an issue with the baby, because all shit will hit the fan then.
Yeah.
Yeah. Uh, and fractures, breaks, stuff like that. So obviously you wouldn't needle with someone with a broken arm.
Yeah. Because their body's already trying to heal
Yeah.
around that area. Yeah, no, that makes sense. And is there anything else that you want to add to today's episode in regards to dry needling? If anyone's listening, kind of going, I've been told to get it, and I've, kind of been umming and ahhing because I don't know what it actually is. Is there any other advice that you would give to those listeners that might be sitting on the fence about doing it?
Yeah. I just look. You can do the research yourself in terms of like looking it up. Don't get, like I said, buried into the some of the things that can happen if someone doesn't do it correctly.
Yeah.
So, and contact the therapist directly that's going to be doing it and chat with them and get a feel for them. Just ask as many questions as you want. Like, it's at the end of the day, it's your money and your body. You want to know that you're getting the right thing. Referrals of that person, same as any other treatment or whatever we do, and just at the time communicate with the therapist. That if it hurts and you want it to stop, fucking say
talk up. And I guess a lot of people don't advocate for themselves in that aspect. They'll wait until it's finished and then be like, "Oh, I'm never going back," rather than communicating. And there's
at the end of the day, like, our job is there to help you guys get back to whatever it is you guys are doing, right? So it's just, deep down, we don't want to see you.
No, that makes sense. I mean, you've done a good job. Like, I get that. I feel like that's kind of covered most things. We've kind of gone through like what it actually is and why it works, and when like we should basically get it done, and I guess how to know that it's right for you. But just like on a whole nother tangent, were you ever scared to needle people? Like, obviously you've been doing it for a while now and you're quite good at like the needles, directly just where to go. How was it when you first started though? Like, I feel like there's not very many people that I know that are good at dry needling. It's probably about 3 off the top of my head. But I guess, how was it when you first started?
So there's another good mate of mine, Lachlan McPhee's over at Mayland. We did our course together, and I just remember in that course, like, me and him were the massage therapists, and kind of everyone else was like physios and chiros. And like, technically, you would think, all right, they're the ones with all the skill, uni degree, all that type of stuff.
Yeah.
They were unsure and like kind of scared to do the needling, where I don't know, I just did it, and I wasn't, they can regurgitate from my point of view in that course. Like, they regurgitate all the stuff like around the biomechanics and stuff like that at the time. But I felt I was better at needling than they were. And in my eyes, which one's better, the person that can use the needle or the person that can tell you how to use the needle?
Well, no, that's exactly right. And that's why I was like, I feel like that is a really interesting way to finish our podcast, because I've always wondered, like, you're sticking a needle in someone's body, like, and obviously every time I visit you, so you're just so confident in just like, yep, that area, and every time it's exactly where it needs to be. And I was just like, when you first started, I just wanted to know, like, was there ever a point where you're like, oh fuck, this is a bit scary? But
I think it's, I'm not scared. I think it's more, I guess you gain more confidence in knowing where you're going and what you can achieve by doing it as well. Which is the same as any job, whatever you're doing. You get more experience, you get better at it.
Yeah, no, that makes sense. And I guess the final question, and I think that's more just out of curiosity, and anybody that's taken the time to listen this far will probably appreciate the question. But in terms of the dry needling and any areas that you guys are trained to not needle, like, is there any areas on the body where, like, technically that you shouldn't dry needle?
In theory, you can massage. You can needle any muscle, right?
Yeah.
areas, I guess, well, obviously you don't want to puncture any organs. So
Yeah.
it's about understanding where everything is within the body. So understanding the anatomy, and then the application of the needling. So where to needle, how to needle, stuff like that, to prevent you from doing any damage to the person. Because yes, you can do some serious damage. Look, I don't know if anyone's died from needling, but
Yeah, no.
you can
Yeah.
and there is some serious injuries you can get if done incorrectly.
Yeah, yeah. Wow. Which I think that kind of comes back to what you said before. It's like, do your research. Like, obviously, like, I highly recommend going to see you, but I guess as an individual, like, when they're thinking about their body and getting needling, like, it's all good and well to listen to one person, but it's like what you said before, read the reviews and make that decision, but make sure it's somebody that's reputable in terms of,
Yeah,
what you're going to have happen.
yeah, for sure. And
Yeah.
the style of needling too. Different processes, could be the same needle, but everyone massages differently. So everyone needles differently.
Yeah, and I have definitely found that, like, with the three people that I generally will be my go-tos, like, you all have different technique and your body definitely feels different after each technique. Like, I know that, and I know that you said that, like, I know that some people leave the needles in for a while. Like, what's the theory about that? Like, you'll put it in, like, it'll have that little twitch and then you'll leave it there.
Yeah, so it's the intensity level essentially. So I guess the needling that I've always kind of leaned to, which is the high intensity, quicker,
Yeah.
faster, but has those potential to be a bit more painful, that type of stuff. So if you were just putting it into someone's muscle and then just leaving it, it's not to say that the body doesn't do its thing. It may just not work as effectively.
Yeah, no, that makes sense, because I feel like some people, like, pop it in and it'll get the twitch, but then they'll leave it there and then move on to, like, the next part of that particular muscle, say it's your calves, like, the meaty part, then it'll go on the inside, but the needles stay in there.
Yeah. I mean, like, we learned all the processes when we did the courses and stuff like that. And I guess in the early days, I guess I did a bit of both. Look, 99.9% of me is just doing that high intensity, fast twitch stuff.
And getting that release and then moving on.
Look, I said I haven't seen Lachlan for a little while, but we did the same course, so I guess depends on how he does his as well. So it comes down to the therapist.
Yeah.
Who you're training.
And their training. Yeah, no, that definitely makes sense. And I hope that, like, anyone that's listened has gotten a bit more of an understanding, I guess, directly, because you can read it and whatever else. And I hate Dr. Google because, as you said, you can get caught up in the, like, this may happen and this may happen, but yet they don't yet research into, like, how, the percentages and stuff like that. So I definitely really appreciate your time for coming on to the podcast, Josh, and I can't wait to see everyone's response after they listen, because then that way I don't have to repeat myself now. I can be like, hey, go on and listen for yourself. So I guess anyone that's listening, if you're dealing with tight shoulders, a cranky lower back, headaches, or even hip pain, book in a session with Josh. And obviously, we've just chatted through, like, the theories and everything behind it. But otherwise, thank you for your time today, Josh. I appreciate it.
Thanks for having me.
And that's a wrap of today's episode. So we thank Josh so much for taking time out of his day to chat to us about it from the therapist point of view. So as much as dry needling can sound intimidating, but when you understand why it works, it releases how powerful it actually is, especially if you're lifting, training hard, carrying stress, or sitting all day. So if you've listened and you're dealing with tight shoulders, a cranky lower back, headaches, hip pain, book in a session, or even just give Josh a call and have a chat. So if there's anything that you can take away from today's episode, is dry needling and acupuncture are two different things. And dry needling and deep tissue massage work slightly different. So again, if you're thinking about it, I hope that we've cleared up some of the questions that you generally have about dry needling and how it can work and if it's a benefit to you, and hopefully taken away that bit of, doubt or feelings of being scared or worried because we're talking about needles. Hopefully taken that away from you. So give Josh a call if you're ever concerned. But again, thank you so much for tuning in to Real Talk Fitness with AMPT. Appreciate your time. So if you feel that someone could benefit from this episode, please share it and tag us AMPT_15 into your post. I love seeing people listen to our episodes. But until next time, keep it real. Catch you on the next episode.